under that is going to be the dimorphic fungus. Starting with the next topic, and that is going to be the dimorphic fungus. I hope all of you remember the basics about a dimorphic fungus, so we are going to quickly revise that first, okay? When I talk about dimorphic, means it's going to exist in two morphologies, and I hope you remember the two morphologies were number one, the yeast form, and the number two was the mold or the hyphae form, right? And now I also want you to tell me the temperatures with the mnemonic that I taught you, that the yeast form is something that you will be seeing in a heat. Yeast and heat are rhyming. Mold and cold is rhyming, right? So mold form you will be seeing in cold. Having said that, so the yeast form is something you will see at a higher temperature of 37 degrees, and mold is going to be something that you will see at a slightly lower, colder temperature, that is 25 degrees. And what are the organisms that come into it? I hope you remember the very famous mnemonic. Because you talk so much about heat and cold over here, body heat probably changes shape, and time and again I am going to come back to this mnemonic. What is it about B? So let's start right away. Rather than writing everything again, we are going to start one by one. So the first one is going to be blastomyces. So blastomyces or blastomycosis, that is going to be the B, and let me show you the classical photo. You see it once, you're never going to forget it. So remember, blastomyces, when I say blastomyces or blastomycosis, it is caused by the same organism, that is Blastomyces dermatitidis. That is the name of the organism. Second, what you have to know over here is it is also known as North American blastomycosis or Chicago and Gilchrist disease. See, if I'm saying something is a North American blastomycosis, there is going to be a South American blastomycosis, and because you're so obsessed with America out here, after that you're going to have a European blastomycosis also. So life is going to become quite complicated. But let's go one by one and solve the complications. So for the time being, the first, if they just mention simple blastomycosis, north obviously comes before south. So north comes above south. So north is the first thing you'll think of. If simple plain blastomycosis is mentioned, and with America, you'll think of Chicago and Gilchrist disease. Having said that, the way you write B, now that is going to change the entire game, because B will tell you that, yeah, it shows you B for budding, but what kind of budding does it show you? It shows you a broad-based budding. It's going to show you a broad-based budding, and that basically means that if, can you see this organism and this picture here? Firstly, tell me, it's looking very, very black. The outlines are looking very black. So if I'm dealing with the black color stain, that stain must have been the Gomori methenamine silver stain used over here, right? Silver is going to give it a black color. Now tell me the next thing, that if I'm seeing a broad base, means if this is the fungus, I'm not seeing a tiny little bud, a tiny tip. No, I'm seeing a broad base. Look at the base is very broad. So that is what you analyze by broad-based budding. Secondly, with the B, you're going to convert it. See, B looks something like an 8. So with the B, you're going to take it into 8, because is this giving you the very classical figure of 8 appearance? That is one very classical catch point about blastomyces. It shows you a figure of 8 appearance, and remember, the size is also going to be a minimum of 8 to 15 microns. So even if you don't want to learn everything, at least learn 8. The shape is also figure of 8, and the size is also going to be 8 microns, and B for broad base, B for blastomyces. So everything about blastomyces is B, 8, 8, and that's the way of memorizing it. We'll quickly do the treatment also. Treatment of most of them is going to be the same. You ultimately have to come down to the azoles. So for mild disease, you have fluconazole, you have itraconazole. So for mild diseases, in all of them, whether blastomyces or the coming dimorphic fungal organisms, it's going to be the azoles. But only if it is a severe or a disseminated, spread all over the body, then before you give these azoles, you also have to give a therapy of amphotericin B. So simple, if it's a mild disease, azoles. If it's a severe disseminated disease, give a drug of amphotericin B, a cycle of that, and follow it up with the azoles. Okay, this was blastomyces. So as I told you, the B1 is sorted for you. What is the next? Body heat. So the H over here is now going to be histoplasmosis. This is going to be histoplasma or histoplasmosis. So let's come down to that. There's a way of learning it, which I'll tell you. But when I say histoplasmosis, what organism is coming to your mind? So that organism is Histoplasma capsulatum. You can see many of them. There's something called Histoplasma capsulatum, or Histoplasma capsulatum duboisi, and that is only on the basis of whether it is seen in America or Africa. So remember, capsulatum is the more common one, which you see everything over here is very American predominant. Dimorphic fungi are very, very common in America, most of them, right? And in America, there is a place called Ohio. I'll be coming to that. Anyway, so Histoplasma capsulatum in America, and duboisi is going to be something to do with Africa. Now, please remember, there's a very famous previous year question regarding the reservoir of histoplasmosis, and this is very commonly seen in the bird or the bat droppings. So, you know, how does it actually come to us? It comes to us by the mechanism of inhalation from these bird or bat droppings, and that is why bats, where will you find bats? Bats you will be finding in the caves. So, one of the other names for histoplasmosis is the caves disease. So, let us do all these names because you have so much of geography and you have so much of bird and bat things. So what are all the names that are given to histoplasma? So how have I learnt it? Firstly, because when you say histoplasmosis, high. So high is going to be a place called Ohio and Darling's disease. So I have learnt it as high Darling. I have learnt it as high Darling. So remember, when you're talking about histoplasmosis, high Darling should come to your mind. High will remind you of Ohio and Darling is going to be the other name. Other than that, I told you it is to do with bird and the bat droppings. So yeah, this is something commonly seen in caves. And now let me tell you the last but the most frequently asked name. It is known as reticuloendotheliosis. What is the meaning of that? Firstly, tell me, what is a reticuloendothelial cell? You might feel that this is a very, very fancy and the reticuloendothelial system might be something altogether new that ma'am is going to introduce to us. But no, it's nothing but macrophages. So where are macrophages present? All over the body, but very common in organs like liver and spleen. So if they want to ask you where is histoplasma going to go and sit, it is going to go and sit in macrophages. But they didn't want to say anything so simply. So instead of calling it macrophages, they said it's going to go and sit in the reticuloendothelial system. But a very famous previous year question. Now, it's a dimorphic fungus, means I have a yeast form and I have a mold form. Let's look at both of these. We'll zoom into this picture first because this picture is the one that we have is the yeast form. And where is the yeast form going to be present? Inside which cell? Everything is going to be inside a macrophage. So let's zoom into this picture. This big cell that you see out here, this is actually the reticuloendothelial cell, or in simple words, it's a macrophage. Why is it a macrophage? I can see that blue color nucleus also over here. And where is the histoplasma then? Histoplasma is the yeast form. So can you see the tiny, tiny dots? The tiny, tiny dots over here, those are going to be the histoplasma. Remember, that's going to be the histoplasma. That is the yeast form. So yeast ho gaya. Now, where is it present? It's usually inside. It can be outside the macrophage also. Now coming to the next, and that is going to be what? Stain. Why is this blue in color? What stain have we used? We have used lactophenol cotton blue. Can you put lactophenol cotton blue directly onto the sample? No. Remember, before putting lactophenol cotton blue, you had to do an SDA agar growth also. So on SDA agar, we can get suede colonies. What is suede colonies? They can be of many colors. They can be white, they can be brown. Suede, it's a cloth. I hope everyone has seen. It's a very thick cloth, a thick and a smooth cloth. That is suede. So suede colonies are seen. And on top of that suede colonies, when I do lactophenol cotton blue, this is the picture that I'll see. Let me zoom into this picture. So this is the lactophenol cotton blue, and if I look very carefully, I can visualize that, yeah, there are some projections coming out. So if I draw it, it looks something like this, and I have some projections coming out. This is a very famous previous year question. And these projections are known as tuberculate macroconidia. These are said to be tuberculate macroconidia. So how am I going to learn all of this? And now I'll tell you the trick. The first thing about histoplasma that I told you was high Darling. So that will remind you that, yeah, it is high for Ohio, Darling for Darling disease related to bird and bat, so known as cave disease, going to happen in the macrophages, so known as reticuloendotheliosis. Now I'm going to tell you that histoplasma is the long lost brother of TB. That's just a way of learning that I have gathered, that this is a very good way by which I can learn. We realized, see, TB is what? TB is a bacteria. Histoplasma is what? Histoplasma is obviously a fungus. So they are somewhere long lost brothers. They are lost in some mela over here, because whatever TB is showing, I'm seeing that histoplasma is also showing. It's like a twin brother. Okay, so now what all does TB show? You tell me. There's nothing to write. Everyone knows the symptoms of TB. There is going to be cough, there's going to be sputum, there is chest pain, there is blood in the sputum, hemoptysis, fever, night sweats. Do I need to write all of that? Of course not. Living in our country, you do not knowing TB is not possible only. Whatever features you knew about TB, the same clinical features are shown with histoplasmosis also. So the clinical features of both of them are the same. Next, what is the very famous necrosis that you see in TB? TB shows you the caseous necrosis. So if TB will show you caseous necrosis, histoplasma will also show you the caseous necrosis. So they are coming across as twin brothers. And lastly, histoplasma decided that my name should have TB in it. So which kind of macroconidia did it show you? It decided to name its macroconidia after its twin brother, that is tuberculate. So remember, I have learned histoplasma is the TB wala fungus, TB jaisa fungus. It is the fungus which looks just like TB. Okay, having said that, so now coming all the way back, we were doing body heat. Now let's come to P for what? So P for actually P is for two things. First, I'll start with the P, that is Penicillium marnefi. Now, remember, I'm going to tell you a very interesting story for that also, but Penicillium marnefi, the name has changed and it is now referred to as something known as Talaromyces marnefi. So that is something you should be knowing. But either ways, whether they write Penicillium marnefi or Talaromyces marnefi, my mnemonic I have made out of marnefi, so that no matter what they write before that, my mnemonic is clear, it is marnefi. So what is marnefi? So when I say marnefi, it sounds like marna. You're going to hit someone. Okay, so whom are you going to hit? You're not going to hit any human being. You are going to hit a rat. Basically, you want to marna, you want a rat to move out of your house. How do you chase a rat? Either you have those rat traps, or otherwise you will say that we go around with a broom or a brush. So I will have something to do with a broom because I'll have to hit the rat and I'll have to make him move out of my house. So when I will hit the rat, obviously the rat is going to turn red. So in Hindi, like they commonly say, that you hit someone so much ke wo lal ho gaya, that is red. Someone turns red, you're hitting that person so much. So marna means hitting. Whom are you trying to hit and make it run away? That is the rat. Till when are you going to hit it? Till it becomes red. And with what are you going to hit it? Is the broom, because now I will tell you the entire story of Penicillium marnefi. If they ask you what is the natural reservoir, the natural reservoir is the bamboo rat. The natural reservoir is the bamboo rat. So first question is done. That is why I told you what is it about rats that you have in front of you. Question number 2. What is the pigment that it is going to show you? Can you see there is a red color pigment that I have in front of us? Yes, this is a red color pigment and it is trying to diffuse out. It is also trying to diffuse out to some extent. So there is a red color pigment formed. So the rat story I have understood because the reservoir is the bamboo rat. The red story I have understood because the pigment is red. But where is that jhadu or broom coming from? So when I did this very famous, from the culture, I picked up lactophenol cotton blue testing. Can you all visualize that these conidia, these small conidia, how they are arranged in the form of a brush? So please remember, there is a brush or a broom conidia morphology that you see. There is a brush or a broom arrangement of conidia that you are going to visualize. I hope that is okay with everyone. Repeating once again, now all your mnemonics will come into place. Whether you call it penicillium or you call it Talaromyces, I don't care much because my mnemonic is going to come from marnefi. Marna. So marna is marnefi. So how are you going to hit this? But whom are you hitting? I'm trying to hit the rats. What is the natural reservoir? It's the rat. How are you trying to hit? Till the time it becomes red. So red is the pigment. And with what are you hitting? I'm hitting with a broom or a brush. So that is the appearance that I get. So after this P, that is Penicillium marnefi, the next one that we go back to is the other P. So I'll take the P and the C together. Now we are going to have something called paracoccidioidomycosis, and this next C is going to be just coccidioidomycosis. So remember, one is paracoccidio, one is just coccidio. Let's start discussing it. So what do we have under paracoccidioidomycosis? This is caused by Paracoccidioides brasiliensis. Brazil means now I am dealing with South American blastomycosis. Simple way to learn if you're good at geography. If you're not, now the confusion has started. Because one side you had something called North American blastomycosis And now on one side, you are having something called South American blastomycosis. So when I told you that north comes above south, right? If you go by just basic, things, north comes above, south comes below. So North American blastomycosis was just blastomycosis, whereas South American blastomycosis is paracoccidioidomycosis. So it's common sense. North comes before or above, south comes below. This means B comes above and P comes below. So if only north is mentioned, I take the first alphabet B. If something below south is mentioned, I take the next alphabet, and that is paracoccidioidomycosis. Okay, America story a lot done, but if you forget otherwise, paracoccidioides brasiliensis, Brazil, South America, that's another way of students learning it. Now finally, what do I see? In paracoccidioidomycosis, I see a lot of PPMM. What is PP and MM that we are talking about? So P will remind me of paracoccidio, shows me, can you see this is looking somewhat like a pilot wheel? It is looking somewhat like a pilot wheel appearance. Instead of a pilot wheel, you want to call it a mariner's wheel, you can. It's showing you the pilot or the mariner wheel appearance. And what is it showing you other than that? It sometimes shows you the Mickey Mouse appearance also. Very, very common question asked. That's why I said PPMM. What is PPMM? P for paracoccidio, P for pilot wheel, also known as MM, also known as mariner's wheel, also showing you the Mickey Mouse appearance. So paracoccidio is going to be PPMM. Having said that, after para, you cut the word para, you are left with what? Coccidioidomycosis. Coccidioidomycosis is caused by Coccidioides immitis. Coccidioides immitis. And remember, if you want to learn this within a second, you have to learn something known as ABCD. So the C is very, very obvious that I'm dealing with the organism Coccidioidomycosis. So C means for that, but D will tell you the other name. Remember, this is known as desert rheumatism. So which desert will they give you a history of? See, look at this name very carefully. Either there's going to be some desert or there's going to be some California valley mentioned. So see, some desert like Arizona. I told you this is all California, this is all US related. America, dimorphic fungus has a long way to go. Okay, so remember desert of Arizona will be mentioned, or some valleys of California will be mentioned. And what is the meaning of rheumatism? Because rheumatism will tell you that there is an element of joint involvement, which I have not told you for any other dimorphic fungus up till now. There's an element of joint involvement, or there can be migratory polyarthritis also that is noted. So yeah, that is what you have to know over here. So simple, if you learn the word desert rheumatism, you know desert of Arizona, and rheumatism is going to be for joint involvement. What is A and B? Please remember, A and B stands for barrel-shaped arthrospores. B for barrel, A for arthrospores. So first and foremost, this is the same picture I had shown you in the beginning of the chapter, and that is these are the barrel-shaped arthrospores. Please remember these boxes that are formed over here. This is the very famous barrel-shaped arthrospores. And why is it blue in color? Because I can see the very famous lactophenol cotton blue. Now, having said that, moving on, what else? I can see these structures, these round structures again with spores inside it. So yeah, that is also a possibility that I'm going to see spores inside these round structures. That's one sort of picture. And the other one is the barrel-shaped arthrospore. So like I said, for coccidioidomycosis, A, B, C, D. What is A and B? A and B is going to be for barrel-shaped arthrospores. C is coccidioidomycosis. D is going to be desert rheumatism. Desert means some Arizona desert or some California valley. And rheumatism is going to be joint involvement. Now, coming all the way back, obviously, again, reminding you of the treatment. Treatment for all of them is going as what? It's the same azoles which are being given if it is a mild treatment. And if it is a disseminated treatment, then how are you going ahead? You are first giving a round of amphotericin B, and then you are going on to the azoles. So the treatment is remaining the same. Coming to the end, body heat probably changes shape, and this is sorted for you. What is that shape going to remind you of? S is going to be for sporothrix or sporotrichosis. Do you remember S was also a part of MRCS, the subcutaneous infections? So can I say that not only is it going to be a dimorphic fungus, but that subcutaneous skin involvement? So I realized that all of these, no matter what I studied up till now, all of these were primarily involving the lungs. primarily going into the lungs. But sporotrichosis is something that is now going to involve the skin, and that is what makes it different. So I've kept the different one for the end. Before I start with sporotrichosis, the end is going to obviously be, so the end of your medical profession. When I say end, I mean when you stop studying finally one day, which is actually never going to happen. But yeah, when you stop giving all these exams, NEET, FMG, INI, CT and all, the day you stop giving all these exams, that is when apparently a good life is going to start. So what is the definition of a good life, if I may ask you? So the definition of a good life is that you don't have to sit in a 6x6 room, or you don't have to sit in a library. You can roam around, you can move out in the fields, you can enjoy nature. So for nature, they have told you that you are roaming around in a field, there are roses, a bed of roses. Good life will be when you are walking on a field of roses. The good life will also be when the area is open, means you can see the stars in the sky. When obviously people like us who are living in Delhi, where you have the worst AQI possible, we never hardly nowadays get to see stars. But yeah, the good life will be where the sky is clean and you can see the stars. Also, another description, if you've seen the Hollywood movies and you know that the good life is always when there's a cigar in your hand. So yes, the cigar in the hand is the depiction of a good life, which I want to tell you is not. But yeah, having said that and preaching that life, that habitual lecture, let me tell you that cigar is something which is said to be good life. So good life will be walking on a bed of roses, looking at the stars up in the sky and having a cigar in our hand. That is the future good life we are working towards. Sporotrichosis is living the good life. Be extremely jealous of sporotrichosis. Now let's start. Which organism am I talking about? So sporotrichosis will tell me that I am talking about Sporothrix schenki. I am talking about Sporothrix schenki. Next, why did you call it? What is the other name? It is known as the rose gardener's disease. So see, the story of rose has come. Why do you call it a rose gardener's disease? Because they will always tell you a person who's working with the rose bushes. Rose bushes means that if there are roses, there will always be a thorn. So they will give you a history of a thorn prick that is going to be there. Now, when there is a history of a thorn prick, you will see that there will be a lesion. Initially, there can be a pustule, there can be an ulcer, there can be involvement of a nodule. So many types of lesions can occur, but whatever will happen at the site of the prick, okay, the trauma. After that, we realized that this is the region where the prick occurred. But apart from this, we saw there were lesions which were spreading like this. They are going in a line. Why are they going in a line? Because look at the other name. It is a lymphocutaneous disease. So remember, you will start seeing there will be nodules along the lymphatic channels. There will be nodules along the lymphatic channels, and that is one of the most important histories that they give you in the exam. They will give you that there is a nodule at the site of the rose thorn prick, and along that, along the lymphatic channels, there are multiple lesions that are going to be there. Now, when I say that, let me tell you the good life, because coming back, the rose part of the story, I have understood how the rose is causing the problem. Let me look at this under the microscope. Now comes the story of the cigar, the story of the stars. Because when I look at this under the microscope, the first thing that I see is this very famous, you can see a star-shaped body, right? So what is that star-shaped body? That star-shaped is nothing but the asteroid body. So this star-shaped body is referred to as the asteroid body. You must be wondering, what are these pink lines? What are these pink lines that you're seeing over here? So this is now known as, I think you know about this already. This is referred to as the Splendor-Hopley phenomenon. This is referred to as the Splendor-Hopley phenomenon. So what do I mean by Splendor-Hopley? I have told you, where else have I taught you Splendor-Hopley? We had studied it in actinomyces, remember? And over there also I told you this was the famous antigen-antibody reaction. So Splendor-Hopley phenomenon, two places. Quick recap, Splendor-Hopley phenomenon is known with actinomyces, and Splendor-Hopley phenomenon is also known as sporotrichosis or Sporothrix schenki. But there are a lot of other organisms that can show you it. There's no end to learning it. These two are the most important ones. But if you are talking about an antigen-antibody reaction, where is the antigen? Where is the organism? The organism is in the center. So this round thing in the center is the yeast, and this round thing is known as the cigar body. So remember, the organism is in the center round thing. So cigar is obviously going to be like this, but they've shown you a cigar like this way. So it's looking like a dot, right? Instead of showing you a cigar like this, they've shown it to you like this. So please remember, you're seeing it as a dot. So that yeast, that organism is the cigar body, and around it, all of this starry thing that you've got, that is the asteroid body. So you've seen the stars, you've seen the cigar. Coming back to the rose, when you look at it under lactophenol cotton blue, can you see another rose-like thing is formed? What is this known as? This is known as rosettes of conidia. Again, another rose coming. So like I told you, this is the rose gardener's disease. Everything about it is to do with the roses, right? Everything about it is going to do with the roses. So we see the presence of rosettes of conidia. So let's do a recap. Why did I call it the good life? Because firstly, you see the presence of rose, so it's a rose gardener's disease, lymphocutaneous disease. You see rosettes of conidia, cigar in the hand, so a cigar-shaped body, stars in the sky, so an asteroid body. That is what you need to know about sporotrichosis. And yes, having said that, please remember the treatment is again going to be the azoles like you've studied throughout the dimorphic fungus, that is itraconazole. But before I end and I go on to the summary, is there anywhere else in medicine or path or micro where you have studied the same asteroid body? It's going to look like the same asteroid body. So now let us do a recap. Please remember that this was an asteroid body. So asteroid is what? See, asteroid is going to be a star, right? Asteroid refers to a star. So stars are seen in two S's. The first one that I taught you over here was Sporothrix. The first one was Sporothrix schenki, number 1. And the second one is an S that you see in the lungs very commonly, many other organs, but very commonly called as sarcoidosis. How do I differentiate? Because the Sporothrix is also looking like a star and sarcoidosis is also looking like a star. Please remember, the star in Sporothrix schenki is extracellular and the star in sarcoidosis is intracellular. How will I learn that? So first and foremost, remember which cell, inside which cell am I saying? See, as far as I remember from our pathology lectures, sarcoidosis shows you a granuloma. Remember, non-caseating granuloma, and if I'm saying granuloma means it's going to show me a giant cell also. So actually what you're seeing over here is a big giant cell. See, look at the number of nuclei. It's got so many nuclei. So this is actually a giant cell. And can you see there is a star inside a giant cell? This is an intracellular star. So if you're seeing something inside, it is the sarcoidosis wala star. But if you're seeing something outside, lying outside, out in the open, the star is just lying out in the open, that is Sporothrix. How do I learn which of them is living the good life out in the open? Remember, again, coming back to the same thing, sporotrichosis, Sporothrix schenki, the rose gardener's disease. He is the one who's living the life and who's roaming around outside in the rose garden. So yeah, that is, since he's roaming around in the garden, the star is also going to roam around outside only. So this is going to be the extracellular asteroid body, whereas sarcoidosis will be the intracellular one. With that, body heat probably changes shape. That's an end to all your dimorphic fungal organisms, and that means we are ready for our final summary. So yes, along the summary, you have body, heat, probably 2 things, and changes and shape, right? Having said that, let's start. You have to tell me their other names and quick revision of all the things that is regarding their images. When I talk about blastomyces, do you remember this is known as North American blastomycosis? And regarding North American, I told you that this is also going to have 2 other names. This is also known as the Chicago disease and this is also known as the Gilchrist disease. How did you identify blastomyces? B for B. So because B looks like an 8, we identified it by the very famous figure of 8 appearance. Coming to the next, histoplasmosis. I gave you a mnemonic. Histoplasmosis high. So it had to be high Darling. Remember, there is something called Ohio's disease. There is something called Darling disease. And because it was also to do with the bird and the bat droppings, so it was occurring in caves and it goes in macrophages. So it is reticuloendotheliosis. If you remember, this was very similar to TB. This was TB Jessa fungus. So if you zoom in and see which kind of macroconidia were you seeing, could you see these? Tuberculate, very famous tuberculate macroconidia. So if you remember these 2 pictures, this was the form that was the yeast form and this was the form that was the tuberculate macroconidia. So please remember this very famous thing. The histoplasmosis shows you tuberculate macroconidia. Moving on, Penicillium marnifi. No one's going to forget that. Firstly, the other name, the new name for Penicillium marnifi is what? Talaromyces marnifi. And what all did you have to know about it? Marna. Whom are you going to hit? You were hitting the bamboo rats. Remember, rats or bamboo rats were the reservoir. You were hitting them till the time their color was becoming red. And what were you hitting them with? You were hitting them with a broom or a brush. So it was showing you the broom or the brush appearance. Coming to the next, paracoccidioidomycosis, which is finally known as South American blastomyces. It is known as South American blastomycosis, and it shows you PPMM. What was PPMM? Paracoccidioidomycosis shows you the pilot wheel appearance. What was the other name for pilot wheel? It was known as the mariner wheel appearance, and then you had a Mickey Mouse also. It was also showing you the Mickey Mouse. So pilot wheel, mariner wheel, Mickey Mouse, same thing. Coming to the next, coccidioidomycosis, that had a very famous mnemonic, that is ABCD. If you remember, C was for coccidioidomycosis, D was for the other name. It is also known as desert rheumatism. Desert rheumatism. Desert will tell you some Arizona desert history will be given. Rheumatism will tell you some joint involvement will be given. And what is the other picture that you have to know? B and A. So what arthrospores? This picture that you're seeing right over here, we can zoom in and see it alongside. So you can very well visualize over here. I see the presence of barrel-shaped arthrospores. So remember, barrel-shaped arthrospores. So the B and A was standing for barrel-shaped arthrospores. Finally, coming to the last one, sporothrix. When I say sporothrix, he's going to live. I'll just write one thing in front of it, which will always remind you that he's living the good life. Means firstly, this is something to be seen with rose gardeners, right? You will see something related to rose. Similarly, what kind of conidia will you see? You will see the rosettes of conidia. What body will you see? We will see the very famous star-shaped body, that is asteroid. Who is in the center of the asteroid? We have the good life cigar. So the cigar body is also going to be seen. So that's a very quick 2-minute recap of all the dimorphic fungal organisms. Body heat probably changes shape. Having said that, let's now, I think we are ready to practice a few questions on the dimorphic fungus. So let's begin with the first one. Which of the following fungal organisms is most likely to be found in the reticuloendothelial system? Reticuloendothelial cells. Which was that one where I showed you a picture? I think everyone remembers that is going to be the famous histoplasma. Remember, it is known as Ohio's disease or Darling's disease or reticuloendotheliosis, also known as the bird and bat, so cave's disease, right? I hope you guys, I told you that time also, it's one of the most frequently asked questions. Coming on to the next question, coming on to this. Okay, this is something which could have come from probably anywhere. A wedge-shaped perforation of the hair is found when the hair perforation test is done. Which of the following infection shows you a positive hair perforation test? Trichophyton, Exophylla wernicki, epidermophyton, or all of the above? This is obviously not from dimorphic fungus, but yes, I'm just making sure that as you're moving forward, you're not forgetting what you did earlier. If you remember, hair perforation test was to differentiate Trichophyton rubrum from Trichophyton mentagrophytes. So basically, what you were using it for is going to be Trichophyton species. I don't see any Trichophyton species except the first one. Trichophyton is there, and which of them was showing you a positive hair perforation test? You remember the mnemonic? So when we wrote Trichophyton mentagrophytes, what had we learned? We had said men are fighting and they are going to fado, that is, they are going to tear apart each other, right? So perforation is going to be done by men fighting. So the positive hair perforation test was by mentagrophyte and rubrum was showing you negative. So over here there is no such option, only Trichophyton is written, so I'll select that. Moving on to the next question. There's a girl who has pricked her finger while working with the rose bushes. I think I've got my answer. She develops a local pustule that progresses into an ulcer and several nodules that develop along the local lymphatic drainage. So first I told you there is something called the rose gardener's disease, and the method of spreading of that rose gardener's disease was lymphocutaneous, and all of that is mentioned so beautifully over here. So we've got the cutaneous involvement, we've got the lymphatic involvement, we've got the garden history, the good life. Garden history, good life means I'm talking about Sporothrix schenki. Coming on to the next question. Okay, so let's see which of the following statements is true for the direct examination of sputum or tissue sample taken from coccidioidomycosis. So for coccidio has been mentioned. Okay, so let's see. So the first one is saying that you are going to see identification of yeast with its pseudohyphae. Do you see pseudohyphae in coccidioidomycosis? No. Pseudohyphae is a very important feature of Candida. So this is the wrong statement over here. Next, the detection of spherules with endospores in it. Did I show you some spherules with endospores in it? Maybe yes, it is possible. So let's consider it as a true statement for the time being. Now we have to read the next. The saprophytic phase is observed as septate mycelium with pyriform conidia. No, that is not something that we had studied. We had studied barrel-shaped arthrospores. So that is again wrong over here. Okay, so next. So this is wrong. This is wrong. Last one. Tuberculate macroconidia. Tuberculate macroconidia are observed in culture. No, as far as I remember, the TB word comes and the fungus that I think of is histoplasma. So that is also wrong, which is the true one. The right one had to be picked up. I feel the second one, where I was seeing spherules with endospores, that is definitely the one that I can see with coccidioidomycosis. Remember ABCD? That was coccidio. Moving on to the next question. Okay, so let's start reading this. You have a farmer in the Midwest of America who has developed flu-like symptoms with fever, headache, muscle pain, cough for a week. So typical flu symptoms. Swab specimens and the sputum sample were taken. Radiographic examination was performed, which showed diffuse bilateral pneumonia. After a week, the mold culture colonies were observed with large and small macroconidia. Name the possible pathogen which the person has been exposed to. So first and foremost, let me go into a little bit of detail. When I'm talking about blastomycosis, are they going to talk about blastomycosis in terms of conidia? No, for blastomycosis, they'll write figure of 8 appearance, which is not mentioned. If they would have been talking about sporotrichosis, that Rose Gardner's history is missing. That is totally ruled out. So when I'm talking about in terms of what is going to be the answer, we either have an option of coccidioidomycosis or we have an option of histoplasmosis. Now as I see over here, coccidioidomycosis should have been the ABCD history. When I say ABCD history, that means that there should be firstly a desert history, something like in Arizona mentioned, and barrel-shaped arthrospores should be mentioned, which is again not the case over here. So when I talk about the Midwest of America, Ohio definitely comes to my mind, and when I say Ohio, that is going to be histoplasmosis. And can histoplasmosis come to you with large and small conidia? Yes, the large one, I know the name also. The name of the large one is going to be the tuberculate macroconidia, right? So yes, they're very much possible, and there will be microconidia as well, and Ohio is fitting very well. So this is the answer. Coming on to the next question, a simple one. Barrel-shaped arthrospores are seen where? So I can very well see that there is a mnemonic called ABCD. Barrel-shaped arthrospores are seen in the desert rheumatism or coccidioidomycosis. You can see the barrel-shaped out here. Very, very simple to identify. Okay, let's pick up 2-3 quick one-liners. Look at this question. Where do you see the cigar body? Cigar, the good life. Cigar, an asteroid. So the cigar body in the center and the asteroid around it. The good life is going to be Sporothrix schenki. But where did you see the sclerotic body? Where did I teach you sclerotic body? I'll give you some other hints. Sclerotic body was also known as the medullary body. Sclerotic body was also known as the muriform body. It was also referred to as everyone's favorite copper penny bodies. Where do you see that? So that was a twist I wanted you to recall from the previous section.